Ohio. Many Ohioans with developmental disabilities encounter obstacles in daily activities as well as accessing education and jobs. A tremendous variety of technology is available that can help people overcome barriers and help them live the lives they want. For example, technology can help someone feel more secure in their home, provide instruction on how to prepare a meal, or help to access public transportation. Supportive technology can also help people with developmental disabilities to have more opportunities to better connect, participate in, and contribute to their communities. Ohio is steadily working to advance technology solutions and ensure that they are available to all Ohioans. In May 2018, the Technology First Executive Order was signed, making Ohio the first state in the country to emphasize expanding access to technology for people with developmental disabilities. The Technology First Rule, Ohio Administrative Code, or OAC 5123-2-01, furthers the technology objectives shared by DODD, county boards, and providers to increase access to technology across the state. The rule calls for technology solutions to be explored and used to the greatest extent possible throughout the person-centered assessment and planning process. Section 2. Why integrate supportive technology in the assessment and planning process? Technology has become commonplace in almost everyone's life, making life easier and more connected. Technology helps people do things easier, faster, and with better quality. People with disabilities have the right to integrate technology solutions into their lives for the same reasons.
I go turn off all lights.
Technology is an important component of support when it is incorporated into a person's individual service plan, also called an ISP. The integration of technology into a person's ISP is called supportive technology. The use of supportive technology is creating amazing possibilities for people. It improves the lives of people with developmental disabilities to increase safety, independence, and control regardless of where a person chooses to live, learn, work, or play. Supportive technology can have an impact on all aspects of a person's life, including, but not limited to, more autonomy and independence, increased access to physical and digital communities, increased access to education opportunities, increased opportunities to obtain and maintain employment, more opportunities to build and maintain friendships and relationships, improved capabilities, and safer and healthier lives. Section 3. Technology isolation versus technology fostering connections. A common misconception about supportive technology is that it will cut off social interactions. Everyone uses a variety of support to meet their day-to-day needs and enhance their quality of life. Supportive technology should not be used in a way that creates unwanted isolation for the convenience of providers. Supportive technology should be implemented in a way that creates opportunities to reach goals outlined in a person's ISP. The appropriate use of supportive technology can simultaneously foster connections with friends, family, and paid supports, as well as give people opportunities for safe and revitalizing time alone. Supportive technology is almost always used in conjunction with other forms of support to create individualized plans based on the person's needs and preferences. Section 4. Supportive technology funding and resources. Accessing and acquiring supportive technology is becoming easier. Ohio's Medicaid waivers have multiple funding options for supportive technology through assistive technology and remote support services. In some counties, supportive technology is also funded using local County Board of Developmental Disabilities funds. DODDs and various other entities in Ohio are also frequently offering grant funds to improve access to supportive technology. DODD, in conjunction with other stakeholders, has created a statewide network of lending libraries, technology experts, and tech ambassadors. This network of resources is removing barriers to accessing and acquiring supportive technology. Section 5. Supportive technology as a tool to address workforce shortages. Disability services and support providers have been facing chronic workforce shortages for decades, and the pandemic made workforce challenges even worse. Service providers are struggling to find enough direct support professionals, or DSPs, to fill support hours. The DSPs that are employed are working overtime, and managers and supervisors often need to work vacant shifts. These long work hours are causing burnout. Consequently, the quality and quantity of supports people receive can be negatively affected. Supportive technology is one tool the disability service system can use to address workforce shortages. Supportive technology can be used in various ways to help decrease reliance on scarce human resources. Supportive technology can be used in conjunction with DSPs, in ICFs, and waiver homes that have multiple staff on duty at one time. The supportive technology can send alerts and information to a central hub, or monitoring center, that acts as air traffic control, and send available DSPs to the person that requires their support. This technology-assisted model allows for improved quality of supports while allowing the reduction in the number of physically present on-site DSPs. Supportive technology can teach skills and provide opportunities for autonomy. When new skills are acquired and a person becomes more independent, they may need fewer hours of DSP support. The use of remote support services can be used in lieu of traditional DSP-provided services. For example, if 5 people choose to use remote support services instead of having in-person staff, their 5 DSPs can be used to fill other vacant positions and shifts. Section 6. Technology and Target Workforce. The target labor pool of the developmental disabilities service system is typically from younger generations who have grown up with technology integrated into all aspects of their life, from social interactions, school, and work. Integrating technology into the methods by which we provide services will feel familiar to younger generations compared to current models of support that have limited integration of technology. Typically, younger generations have a higher level of technological expertise and can also contribute valuable ideas and solutions which will help with job satisfaction and job retention. Section 7. Data and insights to deliver and improve services. Most of the data related to service delivery today is captured by support staff and other professionals by observation. Human observations and documentation are often subjective, and perceptions can vary greatly among support staff. Supportive technology can supplement human observations with concrete data to help a person and their support team make better decisions in the person-centered planning process. For example, sensor technology can be used to alert remote staff or to track information such as door and window sensors indicate someone entering or exiting the home, motion sensors to track movement through the home, bed and chair sensors, sensors that detect if a stove has been left on, sensors on medicine cabinet to indicate if and when medication has been taken, and a seizure detection system that tracks the duration, severity, and other critical information about seizure activity. Section 8. Technology refocuses supports. DSPs and other professionals are often tasked with many different duties that extend beyond the actual support of people with developmental disabilities. Supportive technology can also include solutions that help service providers improve the efficiency of activities not directly related to the care of a person, such as training and documentation, by automating or making these essential tasks less time-consuming. Those providing support will have more time to focus on the person. They can spend more time getting to know them at a much more in-depth level, which results in more personalized supports. We will discuss these service provider solutions later in this training. Section 9. Doing more with the same funds. The Developmental Disabilities Service System is focused on assisting people to live their best life and typically has not made efficiency a priority. Organizations in most other sectors have entire departments of professionals that analyze data, tasks, and processes to determine how they can become more efficient. Implementing supportive technology can help support staff become more efficient and improve services. For example, technology can save DSP time, and that time can be used to support another person. Supportive technology can reduce the cost of care for some support, and the savings can be used by that person to enhance other aspects of their life. Technology can reduce the cost of care across the entire developmental disability system. This means we can provide support to more people with the same amount of money.
Oh crap, I wasn't paying attention. Oh,